Obsessive Compulsive Disorder. OCD is a common, chronic and long-lasting anxiety disorder in which a person has uncontrollable, reoccurring thoughts, obsessions, and behaviours, compulsions, that he or she feels the urge to repeat over and over. The repetitive behaviours, such as hand washing, checking on things or cleaning, can significantly interfere with a person's daily activities and social interactions. For people with OCD, thoughts are persistent and unwanted, routines and behaviors are rigid and causes great distress. Many people with OCD know or suspect their obsessions are not true. Others may think they could be true due to poor insight. Even if they know their obsessions are not true, people with OCD have a hard time keeping their focus off the obsessions or stopping the compulsive actions. A diagnosis of OCD requires the presence of obsession and/or compulsions that are time-consuming, more than 1 hour a day, cause major distress, and impair work, social or other important function. OCD often begins in childhood, adolescence or early adulthood. The average age symptoms appear as 19 years old. Women are slightly more affected than men. Obsessions are recurrent and persistent thoughts, impulses, or images that cause distressing emotions such as anxiety or disgust. Many people with OCD recognize that the thoughts, impulses, or images are a product of their mind and are excessive or unreasonable. Yet these intrusive thoughts cannot be settled by logic or reasoning. Most people with OCD try to ignore or suppress such obsessions or offset them with some other thought or action. Typical obsessions include excessive concerns about contamination or harm, the need for symmetry or exactness, or forbidden sexual or religious thoughts. Compulsions are repetitive behaviors or mental acts that a person feels driven to perform in response to an obsession. The behaviors are aimed at preventing or reducing distress or a feared situation. In the most severe cases, a constant repetition of rituals may fill the day, making a normal routine impossible. Compounding the anguish these rituals cause is the knowledge that the compulsions are irrational. Although the compulsion may bring some relief to the worry, the obsession returns and the cycle repeats over and over. Cleaning to reduce the fear that germs, dirt, or chemicals will contaminate them. Some spend many hours washing themselves or cleaning their surroundings. Some people spend many hours washing themselves or cleaning their surroundings. Repeating to reduce anxiety. Some people utter a name or phrase or repeat a behavior several times. They know these repetitions won't actually guard against injury, but fear harm will occur if the repetitions are done. Checking to reduce the fear of harming oneself or others by, for example, forgetting to lock the door or turn off the gas stove. Some people develop checking rituals. Some people repeatedly retrace driving routes to be sure they haven't hit anyone. Ordering and arranging to reduce discomfort. Some people like to put objects, such as books, in a certain order, or arrange household items just so, or in a symmetric fashion. Mental compulsions to response to intrusive obsessive thoughts. Some people silently pray or say phrases to reduce anxiety or prevent a dreaded future event. Cognitive behavioral therapy known as exposure and response prevention is an effective treatment. A class of medications known as selective serotonin reuptake inhibitors, SSRIs, is effective in the treatment of OCD. Using basic relaxation techniques, such as meditation, yoga, visualization, and massage, can help ease the stress and anxiety caused by OCD. Imaging studies have shown differences in the frontal cortex and subcortical structures of the brain in patients with OCD. There appears to be a connection between the OCD symptoms and abnormalities in certain areas of the brain, but that connection is not clear. Research is still underway. Understanding the causes will help determine specific, personalized treatments to treat OCD. Other conditions sharing some features of OCD occur more frequently in family members of OCD patients. These include body dysmorphic disorder, preoccupation with imagined ugliness, hypochondriasis, preoccupation with physical illness, trichotillomania, hair pulling, some eating disorders such as binge eating disorder, and neurologically based disorders such as Tourette's syndrome. The bad news is that we cannot prevent OCD. But the good news is, it is completely treatable and the person gets back to his normal or at least near to normal lifestyle. Thank you.